Good afternoon, Victoria. My name's Hannah, and I'm a registered nurse here at Baker College Health Clinic. Can you hear and see me okay?
Yes, I can. Hi, Hannah. Thank you for meeting with me.
Of course. I also see your sister Teresa is joining us today. Welcome, Teresa.
Hi, thank you so much for having me.
Before the NP, nurse practitioner, joins us, I'd like to start with some quick intake questions and get an update on how you've been feeling. Victoria, during your annual physical last week, we ran some routine blood work. I understand you've been having a few symptoms lately. Could you tell me a little bit more about that?
Yeah, I've noticed I've been thirstier than usual. I've been getting uh, up at night and using the bathroom. I just feel more tired lately. Like I don't have my usual energy.
Thank you for sharing that. Increased thirst, frequent urination, and fatigue can sometimes be signs of changes in your blood sugar levels. Have you noticed any unexplained weight changes or blurred vision?
Now that you mention it, my vision's been a little blurry, and I lost about 6 pounds without trying.
Thanks for letting me know. And just to check, are you taking any medications or do you have any medical history that we should be aware of?
No, I've been pretty healthy until now. I don't take medications except for a daily vitamin supplement.
Got it. Thank you. I'll make a note of that for the NP, who will join us shortly to review your lab results and discuss the next steps. While we wait, do you have any specific concerns or questions you'd like the team to address today?
I think we're both just a little nervous. We don't really know what's going on, so we'd like to understand everything clearly.
Absolutely. We'll walk through everything together and make sure you both feel confident about the plan moving forward.
Hello, everyone. I'm Melinda. I'm one of the nurse practitioners here at the clinic. Victoria, it's nice to see you again. Who do you have with you today?
Hello, it's nice to see you too. This is my sister Teresa.
Hello, nice to meet you.
Nice to meet you too. Thank you for being here. Victoria, I reviewed your lab results from your recent physical. I'd like to talk about what we found and what it means for your health. Your fasting blood glucose came back at 165. Normally, we like to see that below 110. Your hemoglobin A1C, which tells us your average blood sugar over the last 2 to 3 months, was 7.4. Typically, we like to see it below 5.7. These results combined with the symptoms you described, like increased thirst, frequent urination, fatigue, and weight loss, indicate that you've developed type 2 diabetes.
Oh, what exactly does that mean?
Type 2 diabetes happens when your body doesn't use insulin properly, or it doesn't make enough insulin to keep your blood sugar levels stable. Over time, high blood sugar can affect your heart, kidneys, eyes, and nerves. But the good news is that with the right treatment, we can manage it and help you live a long, healthy life.
Okay, so what do we do now?
Well, first we'll work together to develop a treatment plan. First, lifestyle changes, those can make a big difference. This includes following a balanced diet with fewer refined sugars and carbohydrates, increasing vegetables and whole grains, and we're aiming for about 30 minutes of light activity on most days, like walking. Before we do make any changes, are there any cultural concerns or family traditions that are important to you to keep, like certain foods, meal patterns, fasting practices? We want to make sure we plan to fit your lifestyle.
Yes, actually, our family usually cooks traditional meals together on the weekends, usually, and we'd still like to be able to do that.
That's completely understandable. We'll make sure your diet plan has flexibility so you can still enjoy those meals while keeping your blood sugar in a healthy range. Even small changes can significantly lower your blood sugar. Secondly, we'd like to start you on some medication. Given your lab results, we usually begin with an oral medication like metformin, but in some cases, especially if the blood sugar is higher or the symptoms are more pronounced, we'll start with insulin to help control your body will glucose right away.
Insulin. That means injections, right?
Yeah, it's a small injection under the skin called a subcutaneous injection.
I don't know, I'm a little worried about that part because we're on a fixed income right now, and I've heard insulin can be very expensive. And honestly, where we live, we don't really have easy access to like fresh fruits and vegetables either.
Thank you for sharing that, Teresa. It's important for us to know cost and access are significant factors in managing diabetes, and we'll make sure to address them. I can refer you both to a social worker who can help explore patient assistance programs to help reduce or eliminate the cost of insulin. We can also connect you guys with a dietitian who specializes in building affordable meal plans and can suggest community resources like food pantries that can offer fresh produce.
And on my end, I can help you learn how to administer the insulin safely so you feel confident doing it at home. Would you like me to show you how a subcutaneous injection works?
Yes, please. I've never done anything like that before.
Absolutely. I'll walk you through it step by step. So this is an insulin pen. It's very small and super easy to use. First, you'll clean your skin with an alcohol swab, usually on the abdomen, thigh, or your upper arm. Then you'll pinch the skin gently and insert the needle at a 90-degree angle. On this, you press the button to deliver the dose of insulin. You remove the needle. It's quick and it's mostly a painless process.
Oh, that doesn't look as bad as I imagined.
Yeah, most patients feel the same way after trying it once or twice. And remember, we'll practice it together before you ever do it on your own.
Our goal is to give you the tools and support you need to manage this condition. We'll also schedule regular follow up visits to monitor your blood sugar and adjust medications if needed, and check in on how that lifestyle changes are going for you.
I feel a little better knowing their support. Thanks so much for explaining everything to us.
Of course, we're a team. Victoria, how do you feel ready? How do you feel about taking the next steps?
Yeah, it's a lot to take in, but I feel much more prepared now.
That's great to hear. I'll send you educational materials after the visit about blood sugar monitoring, insulin storage, and diet tips. You'll also get information on local programs, as well as your follow-up appointment schedule.
And please reach out to us anytime with questions or concerns. We're here to help you. You're not alone in this.
Thank you both so much.
Yes, thank you so much. We really appreciate all your guys' help.
You're very welcome. We'll see you soon at your next follow-up appointment, all right? Take care, both of you.
Have a great day, Victoria. We'll talk again soon.
Thank you. Goodbye.